Today, I'm going to talk to you about watchful waiting. So, what is watchful waiting, you ask? When our children are sick, we want to make them feel better, so we take them to the doctor. Medicine has come such a long way that there is a medicine for almost everything these days, and that's a good thing, right? Well, most of the time. Since the discovery of antibiotics, people have come to believe that they will cure all sickness. This just isn't true. Now, bacteria and viruses do have many things in common. They can both be spread by cough and sneezing and through contact with other sick people, especially if they kiss or have sex. You can also catch both of them by touching things that the bacteria or the virus is on, like doorknobs, counters, and products in stores. We can also catch them from animals. They might not make the creature sick, but they can pass these bugs to humans and make us sick. Now, both of these cause similar symptoms, like coughing, sneezing, fevers, vomiting, and diarrhea. So, it can be very hard to tell which one is making us sick. Although bacteria and viruses are both too small to be seen without a microscope, I can assure you that they are as different as goldfish and giraffes. Bacteria are complex little things, and most of them are harmless. Actually, many of them are very helpful to us, and we need them to function. For example, they help us digest food. Fewer than 1% of bacteria cause disease in people. Viruses, on the other hand, are smaller than even the smallest bacteria, and almost all viruses cause illness in people. Bacteria cause infections like pneumonia, urinary tract infection, gastroenteritis, and strep throat. Viruses cause infections like the chickenpox, flu, pneumonia, the common cold, and ear infections. In fact, almost all ear infections start out as a viral infection, often from the common cold. Then, sometimes after the virus weakens our immune system, bacteria get involved and make things worse. Vaccines are the most useful medicine for viruses, but they help prevent viral infections. There really isn't any medicine that will cure a viral infection, like antibiotics cure bacterial infections. Antibiotics are very helpful against bacterial infections, but they do nothing against a virus. This is one reason why watchful waiting is so important. Ear infection is the most common reason children are given antibiotics. Giving antibiotics as soon as the child starts having ear pain means a lot of kids have been given antibiotics for viral ear infections. And we already know that antibiotics don't kill viruses. So when the child is feeling better on day 2 or 3, it's because they would have been getting better anyway, not because of the antibiotics. Giving antibiotics when they aren't really needed exposes bacteria to them, and they build up a resistance to the medicine. Eventually, the antibiotics don't phase the bacteria anymore, and now they are resistant. This antibiotic resistance is becoming a real problem because sometimes they are the only thing standing between us and death from a serious bacterial infection. To help stop bacteria from becoming resistant, the American Academy of Pediatrics and the American Academy of Family Physicians developed some treatment guidelines to show when it is reasonable to wait and see if the ear infection will get better on its own or not. We always treat children who are less than 6 months old. Their little immune systems just aren't developed enough. After that, if the child is younger than 2 years old and doesn't have any severe illness or an infection in both ears, it's reasonable to watch and wait. Children who are older than 2 years old and don't have severe illness can safely be watched for 2 to 3 days as well, even if they have an infection in both ears. This way, we are watching to see if the ear infection stays viral and will clear on its own, or if some bacteria has gotten trapped in there and we need antibiotics to help make it better. There are a few things that are needed to make watchful waiting successful. Watchful waiting is good for children who are overall generally healthy and have mild to moderate symptoms like fever and pain. Fragile or at-risk children with underlying health conditions like Down syndrome, children with speech delays, children who have severe pain or just look really sick are not good candidates for watchful waiting. Fever greater than 102 degrees also usually indicates a bacterial rather than a viral infection. The parents also have to be agreeable to the plan and have reliable transportation to get to the pharmacy or back to the doctor's office for rechecks if it's needed. Now, antibiotics or not, what can you do to help your child feel better? Pain management is the #1 thing in treating ear infections. Acetaminophen and ibuprofen work really well for pain. They will also help with fever. Saline nose sprays and humidifiers can help with clearing the congestion that causes ear infections. Fevers can be really dehydrating. Make sure they get plenty to drink. There's no scientific evidence that warm compresses help ear pain, but as a mom, I can tell you they do. And of course, lots of cuddles and rest. In summary, if your doctor thinks that it's okay to watch and wait with your child's ear infection, they may give you a prescription and ask you to wait 3 days and then fill it if your child isn't feeling better. Or they may ask you to bring your child back in 2 to 3 days to be checked. Please help us to help you to help them in the best, safest, and healthiest way possible.